Good afternoon, ladies and gentlemen. Today I'm going to be making a video about mental health and the three separate components that are connected to mental health. First one is stress, second one is depression, and the third one is anxiety. From time to time I will be referring to my notes to give you a more explained and insightful understanding of mental health. The purpose of this video is to highlight mental health, especially in this time of COVID and the effects it has caused. The video will also involve the different types of mental health conditions, physical activity and mental health common causes / risk factors, facts and figures, signs and symptoms, treatment and management, medication, and finally, to summarize everything. Did you know that 1 in 4 British adults experience at least one diagnosable mental health problem in any 1 year? And 1 in 6 experiences this at any given time, provided by the Office for National Statistics Psychiatric Morbidity Report 2001. The good news is that there is a significant body of evidence supporting physical activity as an effective intervention for the prevention, treatment and management of a range of mental health conditions, which this will be an area I can support and assist you in. The word mental actually relates to psychological health, just as the word physical relates to our physiological health. Good mental health is a vital component of overall health. Understanding this relationship underlines the importance of including physical activity as part of a healthy lifestyle. There is increasing evidence of the effects of mental health on our physical wellness, provided by the impact of exercise on your mental health, Matter 2011. Coronary heart disease, irritable bowel syndrome, respiratory disease, some cancers. These 4 are all believed to be linked with mental health disorders, provided by No Health Without Public Mental Health, Royal College of Psychiatrists, 2010. Now I'm going to be talking to you about facts and figures. 25% of the UK population experience a mental health problem at some point in their life. That's a quarter of the UK's population. 1 in 6 people will have a mental health problem at any one time. This is provided by the Office for National Statistics Psychiatric Morbidity Report 2001. For 1 in 12 people, the problem will last for more than a year, provided by the New Horizons Department of Health 2009. Depression is the most common mental health condition in the world, with 10% of the global population diagnosed with clinical depression at any one time, provided by the World Health Organization 2001. Now I'm going to talk to you about the prevalence of depression. Depression can affect anyone, and I'm sure it's affected many more during this pandemic. It is believed that age and gender may also have an impact. Women's risk of depression is twice that of men, provided by Folger and Gattuso 2002. There is no clear reason for this, although hormonal changes brought on by puberty, menstruation, and menopause and pregnancy may be implicated. Although the risk of depression is lower for men, men are less likely to be diagnosed and receive treatment than women. Men are more likely than women to turn to substance abuse to help them to cope and to commit suicide, provided by Washington University, 1998. The common causes / risk factors are separated into 3 individual groups. 1. Determinants: family history of depression and life events, bereavement, divorce and redundancy. 2. Psychological: pessimistic personality, low self-esteem or self-worth, negative thinking, long-term stress, and early developmental experiences, e.g. loss of parent or caregiver. 3. Physiological: physical illness / disability, particularly progressive health conditions, cancer, heart disease, HIV, stroke, urinary infection, side effects of medication, and chemical imbalance. Here are some of the clinical features. Low mood, reduced interest, enjoyment or pleasure in life, reduced energy and fatigue. Inability to concentrate, thoughts of self-harm and suicide, feeling of worthlessness or guilt, changes in appetite, decreased libido, lethargy, sleep disturbance and insomnia, headache, migraine, aches and pain. Remember that the physical symptoms may mask the psychological symptoms. Now I'm going to briefly talk to you about anxiety, but in future videos to come, I will go in more in depth about this condition, anxiety. I'm going to talk now to you about generalized anxiety disorder. Anxiety is excessive worry that causes significant functional impairment or distress. It differs from stress in that when a stressor is removed, stress is reduced. For anxiety, if the stressor is removed, something else to worry about will take place. Anxiety disorder is characterized by excessive worrying and agitation over a period of 6 or more months and occurs on most days. Physical symptoms: lethargy, palpitations, dizziness, muscular aches, gastrointestinal problems, headaches, and migraine, excessive thirst, frequent urination, difficulty falling asleep or staying asleep. Physiological symptoms: restlessness, feeling on edge, difficulty concentrating, easily distracted, irritability, impatient, and constant vigilance. My personal testimony. Now I'm going to give you a little insight in regards to my journey with mental health. As a young boy growing up, I was exposed to a number of traumatic events that I believe are related to the diagnoses that I received about 2 years ago or maybe less. One being OCD, which is also known as obsessive compulsive disorder. I believe that my 3 separate conditions are interlinked. Trauma in early childhood can result in disruptive attachment, cognitive delays, and impaired emotional regulation. Also, the overdevelopment of certain pathways and the underdevelopment of others can lead to impairment later in life. Childhood trauma physically damages the brain by triggering toxic stress. Strong, frequent, and prolonged toxic stress rewires several parts of the brain, altering their activity and influence over emotions and the body. OCD can be a form of trying to protect and alleviate stress and anxiety from oneself. Compulsions are learned behaviors which become repetitive and habitual when they are associated with relief from anxiety. OCD can be caused by genetic and hereditary factors. Chemical, structural and functional abnormalities in the brain may also be the cause too. Distorted beliefs reinforce and maintain symptoms associated with OCD. I personally believe that the effects of trauma may be strongly linked to the development of obsessive-compulsive disorder. My mental health affected me in so many ways as a young boy, teenager, and man. I believe I was robbed of being me as a person and a mind of peace. My education and learning was greatly affected also. Relationships was also affected. My football opportunity and academy also suffered due to the consequence of my mental health. But one thing I remember is the power of sport and its health benefits it gave to me. Peace of mind for that brief time, joy, bonding, successful improvement of fitness, and the good feeling factor that fitness provided to me. Stay tuned for further videos to come in regards to mental health that will consist more about anxiety, depression and stress. Have a nice day, guys.